Hey everyone, welcome back to Caribbean Wound Based Clinic. We are expecting a patient to return to us for inspection of wounds and change of dressing. We started off our dressing campaign, if you will, by doing a video on simple techniques for just washing of hands. And from there, we are going to lay out all the things that we need for successfully dressing this wound. There's our Inco pad laid out, and I'm applying gloves. You would notice that these gloves are not sterile gloves. You don't need sterile gloves to do a dressing. Sterile gloves are more so for surgical wounds that are freshly being dressed from a recent surgical procedure. But the wounds that we deal with most times are chronic wounds. They do have bacteria on them, much like how you have bacteria on your skin all the time. And you would see me double glove there. Double gloving makes things a little bit easier, a little more convenient. Rather than removing a pair of gloves and putting on another, I can remove them as necessary. We have gauze. We usually use 16 ply 4x4 gauze. It's very absorbent. It's non-sterile, and that's okay. It's packaged that way and is very useful. We're pre-cutting our tape so that when the dressing is complete, we don't have to be stretching here and there and leaving the patient's bedside to get tape. We pre-cut it and it's going to be right there where we can reach it. So you'd see on the layout there are two stacks of gauze. The smaller stack of gauze, we are going to be using that for saline. We're going to soak that with saline, and that saline gauze is going to be used to clean inside of the wound as well as around the wound. And as a primary dressing is the first set of gauze that is going to be in contact with the wound, and the other stack of gauze, which is going to be remain dry, is going to be the secondary gauze. It's going to be on top of the moist gauze that's on top of the wound. This patient is going to require compression, right? So we have our compression bandages here, and that bottle is a spray bottle. Sometimes I'm going to show you two methods. One method, we use the saline in a canister like that, a spray bottle, that sometimes we spray the wound or we spray the gauze, and when we clean and wipe, just for convenience. There's a syringe for easy access into some parts of the wound that might be a little bit difficult to reach. And let's moisten that gauze with some saline. So we only use normal saline to clean our wounds. It's very safe and very gentle on the skin and on the tissues. And normal saline does have bactericidal properties, meaning they will kill some bacteria. Here it is. I'm going to show you the second technique. We have a stainless steel flat tray here, and we put our gauze in there, and we're going to pour some saline into the base of the trough, and that gauze is just going to lap that saline up. So very simple layout for the preparation of doing our dressings. This video is really to enable patients who have to do the dressing at home. It's an outpatient clinic we have, and so we teach you how to do the dressing so that when you go home, things are going to be more convenient. You're going to know what it is you're doing. You are the one doing all the magic at home, and we review your dressing with you. This video can also serve as a help for professional medical staff let's get those wounds healed up.